Have you heard the stereotype of a pathologist as a doctor's doctor hiding behind the microscope? Forget about it. Today's guest is nothing like that. As a specialized cytopathologist, she is patient-facing by the nature of her specialty. She emphasizes the patient-centricity of pathology work not just for the greater good of medicine, but for herself to connect meaning to her work. She co-authored a book, The Healing Art of Pathology, and decided that helping one patient at a time as a pathologist is not enough, and this needs to be amplified, and she amplifies it by being leaders of various organizations, including the Digital Pathology Association and Florida Society of Pathology.
Learn about the newest digital pathology trends in science and industry, meet the most interesting people in the niche, and gain insights relevant to your own projects. Here is where pathology meets computer science. You are listening to the Digital Pathology Podcast with your host, Dr. Alexandra Zhurov.
Welcome, my digital pathology trailblazers. Today, my guest is Dr. Marilyn Bui. We met briefly with Dr. Bui at the Pathology Vision Conference in 2019 when she was the president of the Digital Pathology Association. Currently, she is the president of the Florida Society of Pathologists. Welcome to the podcast, Marilyn. How are you today?
Wonderful. So thank you for this opportunity. It's really nice chatting with you.
Marilyn, I'm going to let you introduce yourself and give us a little bit of your background because there's a lot of leadership and let's just listen to it from you.
I'm a practicing pathologist at the Moffitt Cancer Center in Tampa, Florida. This is the only NCI NIH designated cancer center. So I started working at Moffitt 18 years ago when I graduated from University of Florida with pathology residency fellowship training and also graduate school there in molecular pathology and immunology. But before UF, I went to medical school in Beijing, China. And after I graduated, I came to UF. So you can see I spent almost 20 years in training. I did a medical school. I did some research. I get into graduate school. I did some research. And then I get into my current job. At the Moffitt, I do bone soft tissue pathology, cytopathology, and also digital pathology. At the same time, when you're in a cancer center, in addition to taking care of patients, we'll be do teaching to train the next generation pathologists. And I, with a PhD background, I also do research. Some are translational research, collaborating with PhDs when they discover things in the bench side. I help them to translate it into the bedside can help patients. I also collaborate with the clinicians like a medical oncologist, surgeon, radiation oncologist. And if they discover some magic treatment for the cancer patients as a pathologist, I will be able to evaluate how those therapy working on the patient are effective or not. So once I'm doing all this as a patient-centered pathologist, and I realize with all this work, taking care of patients, research, education, I can only help one patient at a time. But if you are involved in organized medicine to volunteer in the pathology societies, to involved in advocacy, involved in promote pathology and the laboratory medicine, we become more influential and impactful because pathology and the laboratory medicine is such an important discipline. We're like the central nervous system in the whole healthcare system. So we need to protect what pathologist does and augment what pathologists do. So in order to deliver the best quality of patient care. So in a nutshell, I'm a patient-centered pathologist. Everything you see me doing is to serve the purpose of improving the quality of patient care as a pathologist.
And this very much comes across in your book, but we're going to get to your book later. I want to dive into the digital pathology aspect of your work. So in 2019, you were the president of the DPA. How did your journey with digital pathology even start before you became the president?
I started doing quantitative image analysis of breast cancer biomarkers, the estrogen receptor, progesterone receptor, and the HER2 in the 1990s at the University of Florida. And that's my very first digital pathology journey, and I kept up with the biomarker testing component. And then when I started my job at the Moffitt Cancer Center 18 years ago, the analytic microscopy core, which is the core lab of the cancer center, the cancer center has the patient care part, has the research part, everybody share analytic microscopy core. So they need a scientific director. Somebody is a PhD, has the scientific background, and also a pathologist having the digital pathology quantitative image analysis experience. So I fit the bill. So as a junior faculty, I was given that wonderful opportunity. So when I started, I asked myself, I'm a trained pathologist and also a scientist, but nobody ever trained me in digital pathology. I have working experience, but that's a totally different science. So I want to learn about it. So I start to look for associations that is doing that. And Digital Pathology Association is perfect for that. At the same time, there are other like Association of Pathology Informatics. So I became a member. And then DPA was really open their arms. They said, we really welcoming academic pathologists because most of the members are vendor right now. We envision to have pathologists coming in so we can work as partners to advance the science of digital pathology. I was like, this is perfect because the pathologist will be the end user of this. So we need to be involved in design digital pathology at the very beginning so we can make sure that products coming out actually serve the better patient care purpose. So then they said, you will be perfect to be involved in the education committee and help us organize the national meeting. I take on that challenge. So I rise from the member of the committee, chair that committee, and then later on just promoted into executive committee and then eventually the president. So I was trying to find the partners to travel this digital pathology journey together and just being involved and then contribute, and then you get recognized and then you get into that leadership position.
And so I recently learned that this journey to the leadership position, it's like a 5-year long journey. So it's not like you raise your hand and then you become a president. It is a process, and that there's an official goal or like framework for each presidency. What was yours and how did you achieve it?
So basically there are 3 goals. One is to engage and empower the membership because this is a member-oriented organization. So the work is done through the membership and the leadership. So engage, empower membership. That's number 1. Second is to enrich our educational content. So we have this flagship educational meeting called Pathology Visions. That's where you and also have a lot of other revenues now. For example, podcast, white papers, blogs, and regional meetings. And we support our ally society, provide educational content for them. So that's enriched educational content. The last one is to augment our advocacy effort in clear the regulatory pathway, in standardize, for example, introduce the standardization so all the vendors in digital pathology can share a common format. Right now, everybody recognizes DICOM is the one. So this way, digital pathology will be standardized and people can really work together to advance the science in this area. So the way to reach all those 3 goals, the most importantly is engage and empower the board members. We have very talented, passionate, and engaged board members. And the one approach I'm taking is to appoint the key person from the board to be in charge of certain committees. For example, membership committee is a very important one. So we put in a very talented executive into that position. Sure enough, for the past years, every year we reach the membership engagement goal, and then we pretty much blew out all the bar we're setting to ourselves. So now the digital pathology have more than 2,600 members in the DPA. So that's a big improvement.
That's 1,000 more people than I just reviewed an article you wrote for the 10th anniversary, which is when you were president, and it was the number was 1,600, and you're telling
it's like 1,000 more.
Yes,
This is just wonderful. So when you have everything, you build that framework, you put the right person into the right position, and everybody work together. Today's Digital Pathology Association, it's much more mature. It's the leader in digital pathology and AI. So I'm very grateful to be involved in this organization, help me with my professional development in digital pathology, and also help a lot of other people. At the same time, we offer so many opportunities for the next generation pathologists and scientists. They want to be involved. For example, when I finish being the president of the DPA, there's sometimes the president will be active for a couple of years and then they disappear in the background. But I know I still have so much to give. So in addition to what we talk about, I ask myself, what is the legacy? What is the gift we're going to give to our next generation pathologists? So I advocated the DAPA, that's the Digital Anatomical Pathology Academy, collaborated with Dr. Raj Singh, who is the creator and of the Path presenter.
And he was a guest on this podcast as well. I'm going to link to this episode in the show notes.
Very good. So DPA was very supportive and invested in this. Now you can go to the DPA website to check. We have DAPA is very active. Additional component, now we have a brand new DAPA grant round. Dr. Singh invited those famous pathologists in the world to give lectures using whole slide images. We even have DAPA fellows now. Every year we recruit 2 to 3 fellows to help us post case of the month. And because my connection with the Chinese American Pathology Association, I connect these 2 organizations together. Now DAPA has access to all the wonderful weekly Zoom teaching from Chinese American Pathologists Association as added educational material to our trainees. So basically, can you imagine if you are a pathologist, even outside US, you have no access to whole slide image, you have no access to those high caliber of systemic teaching in pathology. If you become either DPA member or the CAPA member, you have access to all those. This is such a wonderful gift of education to all the pathology trainings and the practicing pathologists. So I am very grateful for DPA. Listen to what we have to propose and put the money, manpower, and the support behind it. So we're hoping more people will take advantage of that opportunity. So this is just a gift with open heart, with open mind, and please learn and so you can enjoy pathology and then you can help your patient better. But if you get me started talking about DPA, we're going to take the entire whole hour. Yeah.
So this is fantastic, and I hope this episode is going to help with spreading the word about it to those who don't know about it yet, because the only hurdle is that you don't know about it. Once you know about it, it's a no-brainer, and if you want to learn, this is the place to go. But Marilyn, I want to ask about something that didn't go so well, about a failure or a big hurdle that you have to overcome in this digital pathology trailblazing journey of yours. And tell me about it, and if there was a valuable lesson that you learned from it.
So I recognize the digital pathology's benefit in teaching. So at the very beginning, I started bone and soft tissue teaching site in digital pathology. So I used the scanner. I archived it at our analytic microscopy core because I got a grant to support it. But I didn't think it through. First, those cases are not really linked to the path report. Then you have to physically enter those information. That's one. Second is, how do I share this information? I can only share people who have access to my own Leica scanner. So I cannot really get offside my firewall. So I was like, oh, I hit a wall. Then I met Dr. Raj Singh in one of the digital pathology meeting, and he has Path presenter. I was like, oh my gosh, there is somebody smarter than me. They thought through everything. So we made this perfect match. So we immediately made that connection because our goal is to promote pathology education using digital pathology. So I introduced him to DPA. So we work on DAPA together. And then I introduced Path presenter to a lot of the educational activities that I'm involved, you probably realize that there is a platform I'm heavily involved with called her2know.com. So HER2, HER2. So that's the biomarker for breast cancer. No, it's KNOW.com. So this is a sponsored but non-branded educational platform. We're teaching pathologists to help them to be able to read and interpret the HER2 results much better, because for pathologists, in the era of precision medicine, we're not only making diagnosis, we also report on the biomarker information to provide prognostic and predictive information. The HER2 is a big one because breast cancer is the number one in women. It also causes death. For the longest time, we understand the HER2 as positive or negative. If HER2 is positive, there is targeted therapy treating it. If it's negative, this target therapy doesn't work. But there's only 15% of the breast cancer patients are considered positive. Just in the recent couple of years, there is this landmark study realized even for the 85 HER2 negative patients, there is a great majority, 65%, showing low level of HER2 expression called HER2 low. And there is targeted therapy for it, FDA approved. So the medical oncologists look to pathologists, said, can you help us to identify those patients so we know who to treat? So the company that developed the drug collaborated with pathologists and said, we need to work with the pathologist to do this job better. What kind of educational help do you think we should do? So we proposed a website with didactic lectures. They're recorded and with cases.
I'm going to link to everything you're mentioning in the show notes as well.
Yeah. Oh, very good.
Yeah. Feel free to, throw resources at me. All of this is going to be later in the show notes for anyone who wants to actually look at this.
So that would be a link so more people would know about it. And then I was like, oh my gosh, every time when we show IHS image, it's only one image. But in our practice, we look at a whole slide. So I introduced the path presenter to them. Now there are whole slide libraries on this size. People can actually review. And then we went further. We said we did all those lectures, but we really need to tell people why this is important. So they created this animated film. If you watch it, it's only a few minutes, but every time when I watch it, it just gives me this visceral goosebump. It's showing patients. They got this breast cancer diagnosis. They feel frustrated, especially when they told the HER2 negative. They know there's not much treatment going on there. And then when they realize maybe now there's a HER2 low now, maybe there's a hope now. So we give people hope. And that little video just really touched me at so many levels. And then we were like, then why don't we do a documentary film on the history of HER2 and emphasize the collaboration between medical and the pathologists? I would love to show the life of pathologists. How do we help patients? And people said, okay, that's great. We're going to make a documentary film and you're going to be the pathologist. So there is documentary film now. And the spotlighted pathologists collaborate with medical oncologists. And I recruited my colleagues in pathology to be in this film. And my cancer center was highlighted. They were very supportive. Our marketing person accompanied us for 3 full days to take those shots. So I was like, this is fantastic, because I always knew I want to be a doctor, a physician, but it took me a long time to realize being a pathologist, it's where I fit the best. And in this position, I was able to do all I was described before. I'm able to talk to somebody like you, and I'm able to play in a documentary film.
You wrote the book. So you are like totally not the stereotype of a pathologist. Stereotype of a pathologist is, and you know what? Many people fit the stereotype, and I'm probably partially being one of them, who decided to do medicine, but they didn't really want to interact with patients. So I'm a veterinary pathologist, and I did practice veterinary medicine for around 3 years. And then my decision to go into pathology was I didn't want to deal with patients. You're like the opposite of that. And this is what comes across in all your actions and the way you through your career. And the book, let's talk about the book, The Healing Art of Pathology, where
Yes,
Dr.
yes.
Marilyn Bui is the co-author. And let me just give you my first impression. I bought this book, and it is not a pathology book. It's an art book. Tell me more about this book.
Yes, before we get into the book, the general conception of pathologist. So for the people who apply to pathology, if you go to interview, you go to tell the people interview you, the reason I want to do pathology because I don't want to deal with patients.
Don't say that, right?
That's going to be a red flag. You want to be a pathologist because you care about patient. I guarantee you every single pathologist care about the patient because the report we write down have such a huge impact. But I have to agree that many of the pathologists probably prefer to let our clinical teams be the patient facing and we stay behind to be their doctors. So then we can have a more normal, regular schedule. So we have a little better control of our schedule. So I agree. But all pathologists care about that patient. And there are a lot of pathologists also have patient encounter experience. For example, I'm board certified in cytopathology. I perform fine needle aspiration. So I interact with patients. I enjoy those moments. I sometimes even ask my patient, do you want to see the tissue we got from you? And if they're open to it, I will actually show them what we see behind the scene. Because this was inspired by my patient, Paul. And he gives me permission to mention his name because his story is really inspirational. He made me realize that being a pathologist, every case come to our desk is not just a case. It's actually a patient that deserves our best effort. So when he first came to me, he was diagnosed with a very bad sarcoma. It's the third time already I read all his 3 cases. But I only met him when his cancer already being metastatic, so that's not very good. So he said, Dr. Bui, please show me what's my tumor look like. I want to stare the devils in the eyes. I want to find this devil, but I need to see what they look like. So that's one thing. That made me feel like maybe some of the patients need to know that. So that will give them the courage to fight back. The second thing is, he said, I participated in the dendritic cell therapy. That's immunotherapy. I was told that this therapy will wake up my immune system, generate lymphocytes to fight back the cancer. Can you show me where's my dendritic cells? Are my lymphocytes fighting back? So I was able to find the dendritic looking cells and show it to him and showing his immune reaction and all that. So this connection made me realize when patients are educated about their disease, they become the driver in their cancer fighting journey. So in this case, Paul connected with me. He called me his pathologist. That's such a badge of honor. He connected with his surgeon, his radiation oncologist, his medical oncologist, the wonderful team at the Moffitt Cancer Center. He connected with himself. He looked within, what's my purpose in life? He is a scientist, he is an artist, and then he is a significant other, and he is a son, he is a relative, he's a friend to many. So he did the soul searching, and he decided to fight back, and he got in touch with his faith. So he now is in remission, and he become a much better scientist, much better partner, a much better person. That's his own word. I become a much better pathologist because now I connected with my patients, everybody behind each case in a much deeper level. It's such a humbling experience. I always thought, oh, we're a doctor. We make decisions. No, we are part of the equation in the circle of life. Today, we may be the doctor. Tomorrow, we may be the patient at the receiving end. So we want to train the next generation pathologist. So when I become the patient, the person read my slide will be somebody like me, gave her heart and soul to help that particular patient. So then I thought, wow, I'm going to take those digital pictures, give it to Ray. So Ray started making artwork using his pathology images on the canvas as the background. So this whole process make him energized. So he created a whole series called My Sarcoma. It was exhibited in the cancer center. I partnered with him and we went art show at the Roche. When they were doing the art exhibit, they invited Ray to display his artwork. We went there, attended the opening ceremony, and we teamed up together and gave a talk to the Roche Ventana team as an inspirational talk to show that we're all connected. We're all doing a part to help people like Ray. Then I thought, wow, this is so inspirational. In order for pathologists to do our job better, we need to connect to our patients. We also need to connect to our clinical teams and the general public so they know the critical work of pathology and the pathologists do. By creating this artwork, it's showing a wonderful window spotlighting who pathologists are, their talents, their passion. So you have read this book. It's contributed by pathologists, their families, their friends and patients, right? There are a lot of really wonderful pieces to show the talents behind the people are writing those pathology reports, contributing to patient care. So this whole book making process just make me a better pathologist. Now this book is in the waiting room of the patients. The book has been given to people who are working with pathologists. And this book, when I go out of town to meetings, I donate that to their public library. And also there's a little royalty coming from the CAP publications, but both the co-editor and I, we donate that to the CAP Foundation. We want that money to help other people and also spread the message that pathology is such a rewarding and important profession for us professionally. We want everybody to be able to practice pathology, be proud of what we do, and also spread goodwills, good vibes to the whole society.
So it took me, I had to go through half of this book to gain this shift in perspective that you just mentioned, that, oh, there's the doctor that makes the decision. And it was like I had some kind of inner resistance that, like, that's why doctors become doctors, to tell you what to do and to treat you, and basically transformed my thinking. In addition to that, around the time where I read the book and I got inspired by your other podcast episode at the podcast People of Pathology. So I knew about the book, I got it. And when I was reading it, I learned about friends who were either veterinary surgeons or pathologists being diagnosed with cancer as well. So like, this whole thing and this book like helped me gain a different perspective, understand it in a different way as this hub where medicine, pathology, like other parts of medicine, patient experience and journey come together. So it impacted me in a very specific way.
So I'm glad you went deeper and made a connection with this book, because by making this book, we learned a lot about ourselves and our profession. And it's such an adjustment for me, because that's right before the society recognized there's a huge burnout among the physicians. Pathologists is also one of the group. But because I realigned with why I'm doing it, how I'm doing it, and I don't consider myself it's on this pedestal giving this, I consider myself as part of this circle, this ecosystem. Keep open-minded, keep open-hearted, and then learning from the patients, learning from the cases, learning from my colleagues, and continue to contribute. It's such a good practice. I feel like I'm almost burnout resistant just from making this book, going through this thinking process, and be able to tie everything I do with a greater purpose than myself. And also, you also recognize the commonality between art and medicine, because they are all created for us to unburden the burden that usually humans have, because when we live a life and we always have all kinds of burdens and in front of us, but art and medicine is to release us from that, uplifting us from that and give us a hope. So that book also serving that purpose too, giving us hope. Especially we need to look deep into ourselves to realize we're part of this equation, and being open-minded, open-hearted, we can get a lot more from our work than just doing it in the old-fashioned way.
I didn't know this conversation is going to go that way. I should have expected this, judging by your career path. But this is so true. Like when you connect, often if you don't make this personal connection, and this book, working on this book was this transformation path for you, then all these things like better patient care, better, faster diagnosis, better collaboration, faster drug to market. I happen to work in the drug development work. These are just slogans, and you know you should use them. You see them in marketing materials. Unless you actually connect it to what you are looking at on the slide, and that there is somebody on the other end, and you uniquely with cytopathology, you actually get in touch with patients. Yeah, so I bought this book out of curiosity, and if anybody listening is at least a little bit curious, just get this book and see what it's gonna do for you. I was surprised I just bought it because I'm like, okay, I'm in the pathology world, digital pathology world. Let me buy the book of a past DPA president. And I didn't expect what it's going to do to me. I didn't think I'm going to go that deep.
Oh, thank you so much. There are so many people support this book. I can't even list all their names to support. For example, when the book first published, my state health society said, everybody please buy this book, and to support this book, pathologists in the foundation. And I have a lot of pathologist friends. They buy multiple copies, and then they put it in different places in their break rooms. And then there's one pathologist, his break room also shared by other people, like the firefighters and the police. When they were in training, then they come to this lab and share that, and you will see this firefighter in their own uniform open up this book and reading it. I was like, oh, that's such a great image. And then you will see the vendors for pathologists, and then after they listened to my talk, they said, oh, we're going to purchase this book and give it to our members because their product support pathologists, so need to understand what the pathologist does. There are so many people are supporting this book, including yourself. So I really do.
I'm going to link to it in the description as well. So anybody who wants to have a look.
I have one at the background.
Yeah. Show it.
Yeah. So for that, the cover page is a pathologist, and she's a breast cancer survivor herself. And then when I reached out to her, I said, could you please contribute to this artwork? And she was going to have surgery the following day. So she wrote a very touching piece, talk about why it's in the spiral shape, why she's painting a fish, because it means the transformation. So we all have to transform ourselves, no matter what kind of adversity is in front of ourselves. We need to continue to transform ourselves and then moving forward. So there are a lot of really inspirational messages. And to me, it's almost like a chicken soup for the soul, but in pathology.
Pathology, yeah. Before we go, what do you think is going to be the one thing that's going to drive digital pathology further? What's the next thing that's going to make it more ubiquitous, not just in the image analysis centers, but actually in all the practices? Do you have something in mind?
So short answer is the immediate benefit of digital pathology is the connectivity, because when we no longer chained to the microscope, you can connect with your own colleagues, the colleagues outside your hospital, state, and country, or you can connect to other professions. The second piece is because of digital pathology give rise to AI. So AI can do a lot of things to augment the pathologist's ability. So those are just the tactic. But the strategy is now pathology is experiencing the third revolution. So that's digital pathology and AI, because we're in the precision medicine era, and there are so much information coming down to pathology from the HE, from the IHC, from the molecular pathology, we really need a computation pathology tool because our profession is changing, especially in AP, from just reading, interpretation to measuring, quantification, prognosis, prediction. So strategically, in order for our profession to survive and thrive, we must embrace digital pathology and AI. So all the other things we're doing are main like tech. So if people can understand that, then they're going to realize digital pathology is today's pathology. There are many forms of adoption, but this is going, and then that's the direction we're going. And as a pathologist, when we involved in this, we can control which direction this is going. So hopefully that's helpful and also sums up why we're excited about the digital pathology.
Thank you so much for joining us, and thank you for letting us know about your journey and about your digital pathology journey. I'm going to link to everything that we mentioned in the show notes, and I hope you have a great day.
And thank you so much, and thank you for everything you're doing. I'm a fan of you, and I've been and really appreciate this opportunity.
See, next time we meet, I'm going to break the book and I'm going to have you autograph it for me.
I will be honored.
Thank you so much.
Bye.
Thank you for staying till the end. This was not our classical tech-heavy digital pathology conversation, but digital pathology very much plays in Dr. Bui's mission. So if you're curious about the book that we talked so much about, go ahead, check the link below and see what this book does for me. It definitely did strange things to me, and I highly recommend it. And I talk to you in the next episode.